think the most important thing is that they shouldn't suffer in silence. There are so many different treatments. They need to go and see their family doctor, and there will be a treatment. I mean, the one thing you can say is that every single patient can be treated. It's just really for the patient and the doctor to decide which is the best option for them.
Well, I think what is important is that there's more to sex than just penetration. You know, the end goal of any treatment should not be penetration success. It should be recovering sexual intimacy and sexual pleasure.
If I would like ED patients to know one thing, I think it is that something can be done with the problem. But I also would like to say that it's a very common problem to have erectile dysfunction, so you shouldn't feel ashamed about it. And also, there are many ways it can be treated. It can be medical treatment, or it can be more psychological treatment. So if you have a problem, you should try to talk to someone and get some treatment.
You know, we can help. There's good treatments on the physical side. If you're having difficulty with erections, you know, we can help get your erections back. And on the psychological side, if you're having some anxiety, some sense of stress about re-engaging or entering into a sexual situation, we can help with that too. And so the most important thing is if you're having difficulty with erections, try not to delay coming to see a doctor. Come and see a doctor right away. We can help.
The most important thing to know about erectile dysfunction is that it is often a biological problem. You need 3 things to have a good working penis. You need healthy penis muscles, healthy penis nerves, and healthy penis arteries. And every medical condition can affect muscles, arteries, and nerves. And so when you understand the biological basis of your erectile dysfunction, then you can understand the solutions. And sometimes if the erections are not working, it's a sign that your overall health might be in trouble. Sometimes I'll send a patient to the cardiologist. Oftentimes we'll check testosterone levels, or we'll look at the overall human being who's having the problems and really trying to get at the root cause so that we can find the best solution for the person in front of me.
If I could make sure all my patients knew one thing about erectile dysfunction, it would be this: what's good for your heart is good for your sex life. Both aging men and aging women are focused on living longer and living healthier. The American Heart Association and similar organizations of specialists around the world make these simple recommendations. Eat smart. You can make healthy, delicious choices in grocery stores and in restaurants. Move more, sit less. Being well takes attention and effort. You need to create well-being through self-care. Being well includes getting sleep, managing stress, keeping the mind active, keeping the body fit, and staying socially connected. Cardiovascular health recommendations are all built on the awareness that slow-growing blockages in our vessels, we call these atheromas or plaques, are associated with certain risk factors. Those risk factors are aging, high blood pressure, hyperlipidemia, diabetes, and smoking. As it turns out, these same cardiovascular risk factors impact a man's erectile function because normal erection is based on a healthy vascular system. Sexual arousal by touch or by thought triggers blood flow to the penis, which increases dramatically. How quickly and how well the penis fills with blood is based on those penile arteries. Science has shown this link between penile blood flow and cardiovascular health. Numerous long-term studies of aging men have shown that ED, or erectile dysfunction, predicts the development of symptomatic heart disease. And ED can further predict a symptomatic heart event like a heart attack.